Welcome back. You're watching Sunrise, and we move on to talking about Ebola awareness. The latest figures from the World Health Organization shows that 1,472 people have died from the disease so far in 4 countries: Guinea, Sierra Leone, Liberia, and of course Nigeria, out of over 2,000 cases. What exactly can we do more, especially in Nigeria, where 2 new cases in secondary contacts have been identified? We have in the studio with us the Commissioner for Health in Ogun State, Dr. Olaokun Soyinka. Thank you so much for joining us this morning.
Good morning.
Oh, what's your assessment of Nigeria's containment efforts so far?
Well, I think it's been fantastic, and I think if you read the media reports, there's a lot of good words being said about the Lagos State response, about the speed at which it was picked up, and of course the subsequent response involving federal government partners to support Lagos. I think we've seen real teamwork and a very rapid coming together of the necessary expertise. However, the arrival did expose one thing. Ebola and containing such epidemics, it's all about prevention. It's all about the robustness of your basic healthcare system. And that is what Ebola has, why Ebola has made us rather nervous, because we all know we're still struggling to get our health systems back on their feet. And diseases like Ebola, they find the gaps, the preventive gaps. Everything from health literacy to our public health systems, to our surveillance, to the existence of infectious diseases units, intensive care, logistic supplies. You know, it begins to make your health system creak at the edges. So the response has been very good, and I hope after this has died down, we will have a lasting positive effect, because everybody has seen that these things that we take for granted, we can't. We are vulnerable, and we have to put things in place.
So what is Ogun State doing to match that level of ability to respond very spontaneously and very quickly to this kind of infectious disease?
Well, we've been lucky, being right next door to Lagos, and also having a rather long section of the border with Benin, which of course is the gateway to the west of the epicenter of the outbreak in West Africa. We've been lucky in that we haven't had it. We didn't get it first. So of course we can very quickly understudy what is going on and learn the lessons that are being learned, so that we don't make those mistakes. Actually, before it got here to Nigeria, we've been watching what was happening down the coast, and it was clear that, you know, it was beginning to spread, and that we were vulnerable, and there was a suspected case in Ghana. So at that point, the governor released some funds for us to do training across all our local governments to raise the level of suspicion for healthcare workers. If you look at what happened in Lagos, it was because the first healthcare workers that came into touch with Patrick Sawyer, although there was a gap, but they did quickly recognize. We've never had it in this country. So the fact that they recognized it within 24 hours, I think, is a credit to the medical staff, one of who's sadly, or some of who have sadly died. But they recognized it quickly, and so therefore surveillance and picking it up early is the key, because 1, you reduce the number of contacts, and 2, you're able to give them early treatment and care, which we have shown reduces the death rate. So we not only have been training our healthcare staff and giving them reminders of what this disease is like, how it presents, and what to do when they get a suspected case, but we've had the time to set up isolation units, buy in the necessary
How
protective.
many have you got around the state?
We've got 3, of which
Is
one
senatorial
is
districts?
yes, one in each. You always have to think about politics, you know, even though the virus is apolitical, but you know, we have to think about, and it's not just about politics, it's about fairness. You have to make sure you are putting whatever you're putting in place, because again, it goes back to what I said earlier, that our health systems are lacking. So these units that we're putting in place, they will remain as a resource, as an asset in the healthcare system of any particular area. So we need to spread these things around. So, but our aim is to have one in every local government. But you have to start somewhere, get it ready, so that if there was a case today, we have that needs isolation, we have somewhere to
but
put.
when it comes to the issue of when it comes to the issue of what some doctors have said, the training you've given, is it to public health workers, or are you engaging private doctors as well? Because a couple of them were on this show a couple of weeks ago and said the private sector, the private practice doctors are not being carried along by some of the state government.
There are thousands of them. They are also not, in the way the state is, linked up together in a way that you can easily address all of them in one go. Nevertheless, when we did our training, for example, back in June, I think out of the 110 healthcare workers that we trained, I think about 20% we drew them from the private sector. But you know, if I say I'm training a trainer, and I bring a local government health worker, say a medical, the medical officer of health from the local government, and I know they will go back and then they will go around and train others. If I bring a private practitioner in, he may be on his own. He might have one or two other. He might be have a chain of hospitals if I'm lucky. But how far that particular resource that you've put in and the time and the money, how far it goes could be very limited. So we could do a lot better, I think, but it takes time and resources, and of course those are scarce, and you always have to make the choice.
Sorry, Yomi, part of what was mentioned is the fact that First Consultant is a group of individuals who are private practice doctors, and they were able to do this, maybe rightly or wrongly, because they were private sector and they know how to do things procedurally very quickly, very well, and so on and so forth, not government-based. So if you're looking at the way this might pan out, if there is, God forbid, as we always say in Nigeria, God forbid, if there is an incident of it in Ogun State, it might end up being in a private doctor's clinic.
It could. There are, I think the split in Ogun State, according to our statistics, is 50-50, maybe 60-40. So there's a very high chance it ends up in a private hospital. But don't forget, there are large private hospitals, very few, you know, the chains, the groups. Most of the private hospitals are small clinics, all these little specialist hospitals you see on the corner and side of the road and what have you. So it's also not, you can't maybe compare, you know, First Consultants with a small one-man, two-man, one doctor and his staff practice. And that is really why raising awareness is important, because actually the care that is given is not particularly specialist. The care that's given to a very sick person is, but you in that case have time to refer. We're talking about picking them up and the care that needs to be given initially, which is making sure they don't come into contact with others if they're infectious, running the tests and giving them the supportive, initial basic supportive treatment. But of course, what the public health response is when you have a patient that's got to that stage, then the government steps in and takes them from you, because they've now got the resources to isolate them. We've got all the protective gear, the disinfection materials, and of course we've trained our staff and we keep training them. And that's one of the benefits that I mentioned earlier, that all these techniques, it's not just for Ebola, it's for any kind of infectious disease that you need to contain. And we're still not safe from those things like that came before. Lassa fever, swine flu, bird flu, they're all still around us. And of course there are other infectious diseases that are around us all the time, you know, like TB and what have you. So these are techniques that we really need to be bringing up to another level. If you go to some countries with better health systems, they will always have in every hospital somewhere where they can put a highly infectious patient, and the staff will have been trained and retrained over time on barrier nursing, the infection prevention and control, how to stop the staff getting infected and how to stop the staff carrying that infection and giving it to others. This is a normal part of the training, and I think these are some of the things that, given that we're in the tropics where infectious diseases are rife, it's surprising how poor we are at dealing with them.
Okay, now let's go back to the national level, looking at the entire figure that we have. We have 14 confirmed cases, 2 of which, you know, were found in secondary contacts. Is this something to worry about?
Well, funnily enough, it should be something reassuring. if we started getting cases that just popped up in the community where you don't have the chain of contact, then you would begin to worry that, okay, we have them wandering around and there will be more popping up. If you can identify how this person got it and know the circumstances, then those circumstances can reassure. And they do, because so far it's been healthcare workers or close relatives, these two new ones are spouses. So it reassures the general public that, look, as long as I'm not, having a close contact with an infected person, then I'm not likely to get this. Healthcare workers and spouses. So you really are going to have to struggle to catch Ebola, because you have to first of all bump into somebody who has it, and you get sick quite quickly, and you're not likely to be roaming around when you're infectious. And then you have to have the sustained, you have to have the contact with the bodily fluids. So it's not actually easy to catch.
Okay, and now the minister said like about 9 of those infected, they are either doctors or nurses. How are you allaying the fears of the health workers? Yes, you're training them to be able to handle the cases, but the deep down fears in them.
It's difficult, and one of the reasons it's difficult, once you tell a health worker, look, the reason people get it is because they've not, the health workers have been getting it, either they haven't had the proper equipment, or because they've been careless and not followed the proper procedure. But then they point out cases, they say, oh, well, what about the 2 Americans, or what about the, the Liberian doctor expert who sadly died recently? And so there's this fear that no matter how well protected you are, no matter how well trained you are, that you can still get it. But I think it's been shown, and even from the stories of those who got it, that there had been such long-term, such sustained hours of work that they got careless. They didn't follow the full procedure. They were trying to do more than they should be doing, and they exposed themselves to the virus. So the message still is, and the message that we give to the healthcare workers, if you follow procedure and you wear the right protective equipment, if you're dealing with a patient who has proven Ebola, you will not get infected. We also have to reassure those who are not even going to be directly dealing with the patient. If you are setting up an isolation center, you have to have security guards, you have to have caterers, you have to have cleaners, you have to have people who dispose of the waste. And some of those are high risk, some of those are low risk. But basically everyone goes, even when we chose our centers, we had big issues with the communities, because they were just saying, no, you're bringing Ebola to our vicinity. No, we don't want it. Yeah. So when we explained that, no, we're going to put one in every local government, you are lucky to be getting the first one. So, it's about giving people the right information.
You talked about the fact that you have a long stretch of border around Ogun State. Now, how are you managing the borders around the state and the entrance, some of them not official, where people can come in without being detected?
It's difficult because, of course, it's federal government responsibility, but we can't just fold our arms and say, therefore, that we wouldn't do anything. Very early on, when the case came to Lagos, Senator Amosu convened the State Security Committee, and he had addressed and briefed all the, especially the customs and immigration, the police, and what have you. And they were able to reassure us that they had asked the federal government to help them increase the resources, human resources, and equipment that they have along the border. The problem is not actually the conventional crossings. The problem is all those bush paths and even roads that are unofficial or illegal borders. They're difficult to police. If you do block them, people just, go around the next available place. And actually, because they're often smugglers' routes, people get violent. And so, you say, it's easy to say, send somebody there, but that person going there knows what happened to his predecessor who tried to stop smugglers going through. They attack you, and
they carry guns,
they carry guns
kind of
and all that. Yeah, they do not want their livelihood interrupted. So it is a big and a worrying problem, and that's in fact why we're more worried in Ogun State about the border than we are about Lagos State. I mean, they're identifying, they're doing the hardest job, which is contact surveillance and follow-up, contact tracing. and monitoring those contacts. So we're not so worried about Lagos, but the border is, you know, these viruses are proving to be, you know, travelers. And sooner or later, whatever happens with this outbreak, we are going to have a public health system that can detect and cope with these new emerging viruses. We've seen them here. Swine flu, bird flu, SARS, even HIV/AIDS is a relatively new virus. And the virus is a very tricky life form, and it evolves very quickly, so it escapes our measures for control. So we have to be really on the alert.
And the message that, you know, when we talk about Ebola, it is highly contagious, and so people get so panicky, and they think once you have it, that is the end. But we have seen from figures, like the WHO said, there's been 2,615 cases with 1,470